And I was crying on the staircase, begging you please don't go. And I said, Romeo.
I don't hear you.
Hello. Yes,
Hello?
yes. Hello, everyone. How are you this evening? Are you excited to be here? We are more than honored that you would spare your Tuesday evening to be with us. And we are looking forward to really learning about the history of mental health or rather trauma and mental health. And I'm really glad because as I was just having a discussion with Professor, I realized we have really so much to uncover when it comes to mental health, especially for us as a continent. So we are really honored to have you. The whole of East Africa is here today. We have a few people from Malawi. We have a few people from Zambia. We have a few people who I think I saw from SA. So we really appreciate that you would spare your time to come and just learn more and be part of the change that you'd like to see. So my name is Grace Nzula. I'm an HR consultant with Atara Solutions. Atara Solutions is a HR consulting and training firm. And you're tuned in to a program we call Get It Right with Atara Solutions. Now, Get It Right with Atara Solutions is a program that seeks to demystify issues in employment and entrepreneurship. And we do this every Tuesday from 8 p.m. We're actually on season 6. We started off during COVID, and we are still here. And we believe that we are on a mission to change the world through information. And it's an honor to be here. So, of course, we have my co-host, who is Catherine Sidandi. Catherine Sidandi is our sign language interpreter, and she does an amazing job. Thank you so much, Catherine. You're an amazing soul, and I keep praying for blessings upon you for sure. And thank you for agreeing to be here every Tuesday and offer your services. And I hope that the people on this call, if you ever need a sign language interpreter, please call on to Catherine Sidandi. Because we need to be inclusive, we need to support inclusivity, both as organizations and also on our part as individuals. So Catherine Sidandi, we appreciate you and thank you for everything that you do for us and for the community. So Get It Right, we are in partnership with a number of organizations who support our mission in one way or another. Hey, where is that one now? Where are they to? Okay, I know why. So we have a number of partners that we work with. Sorry, I'm having tried to figure out my tech issues. These are the days I really miss Kevin. He'd come through for these things at this point in time. Nonetheless, we are here and we try to move on. Right, so a number of our partners allow us to give them a shout out. We have Pathway Solution Services. Pathway Solution Services is also a HR consulting company, and they offer you discounts on their LMS. LMS is Learning Management System. We also have Nile Front Cottages. Nile Front is a hotel located in Jinja, Uganda. It's one of the most beautiful, magical places I've been to. The views from these cottages are, oh my God. And then imagine you take a cottage and you have both the sunrise and the sunset when you're seated at the porch. And then it is located where Lake Victoria meet with River Nile. It is such an amazing place, very magical place. Their sunsets are amazing. Don't ask me whatever, you need to just take a trip down. It's actually 2 hours from the border. So you can actually drive from Nairobi. And for those in Kampala, you really need to go and check out Nile Front. And then also there are the people who have Skia restaurant running in Jinja, which is a restaurant that is, the people who serve there are actually deaf. So it's such an amazing place to be. Then we have Elsame. Elsame is a lodge located in Naivasha. It is, again, a very serene place. For book writers, this is the place you ought to go and lock yourself. For those who want to go and enjoy quiet and enjoy romantic places, then Elsamere would be your place. They also have beautiful conference facilities. So take advantage and go. And you can also drop Atara Solutions name, and I promise you, you'll get better discounts. And then we have Labor Planet. Labor Planet is an organization that does manpower outsourcing. So for all the HRs here who are looking to outsource labor, Labor Planet is your go-to person. We have Steadfast Quality Solutions. Steadfast Quality Solutions is a HR and PR consulting company in Kampala. This is led by my good friend Herbert Zake. Herbert, thank you for your support. Thank you for introducing me to Professor and all the other trainers that we have met from Kampala and Uganda in general. And Steadfast Quality Solutions are into board trainings and board evaluation. So if you have a board that is requiring training and you have a board that requires to be evaluated, then go for Steadfast Quality Solutions. They do such an amazing job, and I'm sure you will enjoy the encounter with them. And we have K-Square HR Services. K-Square HR Services is our partner in Rwanda. They offer total HR solutions, and they are also in training. By the way, they have an upcoming training. So if you're in Rwanda, please tap into the services offered by K-Square HR. And we thank you, Steve, for also sharing our flyers and recommending speakers from Rwanda, and also just helping us spread our wings across East Africa. Of course, we have Essence Park, we have Kapula Mintito, we have Panessa Training Institute, we have Wicklin, we have Profiles International, and we have Festac Africa Festival. Now, Festac Africa Festival is a festival that's coming up in August that is seeking to celebrate Africa. It's going to be happening here in Kisumu, Kenya. And it's going to bring people from all walks of the world for this one. So please don't be left out. If you want to understand Africa, if you want to celebrate Africa, come and showcase your product and also get to learn more about what we can do in terms of business as a nation, as a continent. And then my favorite time of this season, we have a men's hangout coming up. On the 22nd of June, we shall be hanging out with the men. It's called Meet and Greet. So that means there's a lot of food, there's a lot of networking opportunities, and our theme is Natural Born Leaders, the modern authentic man. So we have different speakers coming in. We will be releasing the flyer with all the speakers soon. So please do not be left out. This is an opportunity for men to have that conversation that has been long overdue. And we are proud to be among the first people to actually organize a men's hangout, especially in the HR sector. But we have people who are coming in. Our speakers are from career people, they are business people, we have mental health, among other conversations that we are going to have, because natural born leaders are men, really natural born leaders. The expectations of a man is to provide leadership, and leadership means that you need to invest in leadership development. So come on, come on, let's hang out on the 22nd of June at Absa Sports Ground here on Thika Road, or rather near KCA University. And it's only going for 4,000 shillings. Please do not be left out, and get in touch with us for more details. All right, and that's it for me and our shout out. So allow me to welcome our speaker of the day. And just to check, let me just confirm that the live stream is actually happening. Okay. It is still safe to say we are safe. You know, sometimes we end up forgetting that we are live streaming. So I can confirm that we are safe. So yes, we are also live on YouTube. So that's what I was confirming. So our speaker of the day is a person who, when I sent out the flyer, the feedback I got, it got me excited to learn from him and just get to understand more about trauma and mental health generally in Africa, and probably just to understand our history more. And understand maybe where the rain started beating us. So allow me to welcome Professor Musisi. He's one person, when I shared the flyer again, people are saying, oh yeah, I know him. I have interacted with him severally. Oh yeah, he has done a presentation for us somewhere. So Professor Musisi, you're actually a celebrity in the making. So Professor Musisi is a former chair of psychiatry at Makerere University, where he obtained his medical degree, and then he went to University of Toronto in Canada, where he specialized in psychiatry, and then he has special interest in psychomatics. liaison and intensive care psychiatry. And then he came back to Uganda and founded an NGO, the African Psychcare Research Organization. Was to research, teach, and consult on African mental health problems and their management. He has worked in government, universities, and private psychiatric settings. He's a Fulbright New Century Scholar and a fellow of the Uganda National Academy of Sciences, and is the founder and CEO of Entebbe Lakeside Hospital. He's widely researched and published in the psychiatry of trauma, HIV/AIDS, severe mental illness, and old age as seen in Africa. Ladies and gentlemen, allow me to welcome our speaker of the day to start us off. Welcome, Professor.
Thank you. Thank you, Grace, and thank you for the kind introduction. And let's get the show going. You got the slides? Okay. Thank you very much. Next slide, please. That has been done. But I would like to thank you for inviting me to give this talk. And since we are not all psychiatrists, I thought we should begin with the principles of definition. So what is mental health? Now, I'll tell you what the WHO says, that it's a subjective sense of well-being and a perceived self-efficacy, being autonomous, meaning that you can do things and you can handle life's challenges independently. But you also depend on others for your everyday life, and that you can fully actualize your intellectual and emotional potential, and not just the absence of mental disorders. But mental illness itself is that illness with psychological, emotional, and behavioral distressing symptoms or impairment in functioning, which deprive you of your happiness or your satisfaction in personal and social relationships or fulfillment. It becomes a mental disability if the illness does not allow the individual capacity to fulfill their social roles or adaptation, or take responsibilities, or tell right from wrong. They can't handle frustrations, they can't cope with life, they can't enjoy life. So what drives, next slide please, what drives the high rates of mental illness in Africa? I thought, please, next slide please. Well, maybe let's go. What I thought about is to tell you why there's increasing problems with mental illness in Africa. One is that we have too many traumatic situations, wars, militarized politics. When Africans go to elections, it's like going to war. Human rights abuses. I think you've gone the slide too fast. Domestic violence, like intimate partner violence, child abuse, sexual abuse, accidents and disasters. We also have lots of infections, HIV/AIDS, COVID, brain infections. Then we have had now substance abuse coming our way, alcohol, drugs, and we have a lot of poverty. This caused a lot of difficulties for us. We have unfulfilled expectations, making our citizens go to migrate from our continent to go elsewhere to almost work as slaves. And we have poor access to care. And a lot of our people have mental health illiteracy and also general illiteracy. And then we have urban overcrowding as people run from countryside to urban centers. And then our school systems are also not the best. So these things tend to drive the mental health agenda in Africa, causing a lot of stress to us. Next slide, please. And we define stress. When we talk about stress, we talk about the everyday definition, like from dictionaries, that there can be physical and psychological stress. Physical stress, we all know, when a force is applied to a body that strains it or deforms it, like for example, carry a heavy load on your head, or when you're pushed, But what about psychological stress? That is a mental tension. For example, when you have to meet deadlines, when you feel urgency, when you feel an emotional unpleasantness, and usually this psychological stress becomes associated with physical discomfort. So what is psychological stress? Next slide, please. Psychological stress is a perceived demand on an individual that cannot be mastered or managed within a given time. You cannot meet your demands within a specified time. It can be internally or externally generated. It causes emotional tensions and causes symptoms, which can be physical or psychological. So how do we classify this psychological stress? One, we have what we call acute stress, and we have chronic stress. Acute stress is when it happens suddenly due to an unexpected force or demand on you. It causes acute symptoms, like, for example, fear, panic, feeling threatened. It resolves quickly when the stressor is removed, but it is often time limited and positive and life enhancing. On the other hand, chronic stress is due to enduring or repetitive demands or forces on you, and it causes long-stay symptoms of looming danger or threats. It may not even resolve when the stressor is removed because you keep the fear within yourself. It often has physical, psychological, and social complications. And this type of stress, the chronic stress, is often negative and unproductive. So, what about traumatic stress? This is stress caused by a traumatic event that results in a distinct mental disorder. And these distinct mental disorders are adjustment disorder, because you have to adjust to a new stress. For example, you have had recent floods in Kenya and also in Uganda. That alone will cause you to have to adjust to that stressor. It can be acute stressor if it lasts, about 30 days. But if it goes longer than that, it becomes a post-traumatic stress disorder. In other words, the trauma happened, but now you're having stress in the post-traumatic situation. And this post-traumatic stress disorder is popularly called PTSD. Now, so the question usually is that, what is PTSD? And it reminds me of Dr. James Walugembe, the late, who died in 1992. Died a few years later. But in 1992, he was defending his master's thesis in psychiatry at Makerere University. And at that time, people did not quite understand what post-traumatic stress disorder is. And he said that change and adjustment are part of life, but stress affects everyone because we always have changes. However, traumatic events can sometimes be overwhelming to an individual, shattering you emotionally and leaving a feeling of total helplessness. When a person is faced with a threat to life, a risk of bodily injury, or a loss of security, the usual mechanisms of coping fail. Psychic trauma occurs when an individual exposed to an overwhelming event results in helplessness in the face of this intolerable danger, exposing him or her to have excessive anxiety and some kind of instinctual arousal to either flee, fight, or cope. The resulting psychological or physiological tension can lead to various emotional and physical symptoms and illnesses. These traumatic events can bring on specific constellation of severe and prolonged disabling symptoms. That is what post-traumatic stress disorder is. With that definition, you can see that maybe we have all gone through, from time to time, traumatic situations which could meet the symptoms of PTSD. Now, this PTSD has had various names in history, but has always been related to war. However, in 1980, the American Psychiatric Association included it as a mental disorder in its classification of mental disorders. But before that, it had been defined variously. For example, in 47-48, it was called concentration camp syndrome after studying Jews that had been put in regional concentration camps who had survived. But earlier on, in American Civil War, it was called soldier's heart because of the tendency to anxiety and the increased heart rate that people felt. or irritable heart, defined by Da Costa, and it was called Da Costa syndrome. In World War I, it was called war neurosis because of what people had seen. And you can imagine going through a war and the kind of mental problem that you develop. Or some people used to call it combat fatigue or exhaustion, especially in soldiers. In 1952, the Americans began classifying mental disorders, and they called it gross stress reaction. But various people have been defining it. For example, it was called the Gulf War syndrome when Americans were in Vietnam in 74. Burgess, studying rape victims in Congo, called it rape trauma syndrome. All these various names have now been amalgamated into what is known as post-traumatic stress disorder. So what are the signs and symptoms, diagnostic criteria, we call them, of post-traumatic stress disorder? There are about 5. That one, experiencing, witnessing, or being confronted by a traumatic event which threatens your life or your body integrity of yourself or others, especially those close to you, causing you to have excessive fear, helplessness, and horror, even just hearing about it. And then you experience this traumatic event coming to you all the time, even if it stopped a long time ago. So you have constant recollections and intrusive thoughts about it. You get bad dreams or nightmares about it. And during the day, you have flashbacks of the trauma. Then you begin to avoid any reminders of that trauma. For example, if you saw somebody being shot, seeing somebody with a gun could threaten you, could frighten you. So you tend to avoid it in your thoughts, in situations, or in going to places where the trauma occurred. You don't even want to recall it. And then you have this instinctual arousal that you're always on edge. You can't sleep well. You become irritable. You have anger outbursts. You're hypervigilant, looking everywhere for enemies. And any sudden noise or things that threaten you give you a startle response and makes your body react autonomically. Heart rate's going up, sweating, trembling, and really fearing, and breathing heavily. Sometimes it's chest pains. The symptoms to meet criteria for post-traumatic disorder must be continuous for more than a month. If they are less than that, they are adjustment disorders. And they cause significant distress to the affected individual. So how do we classify these post-traumatic stress disorders? One, as we say, it can be acute if it lasts less than 30 days. If it goes on, then it's called acute stress disorder. If it goes on for about 1 month to 3 months, we call it acute post-traumatic stress disorder. But it may go on for longer than 3 months, sometimes to a lifetime. Then it is chronic post-traumatic stress disorder. Sometimes the symptoms don't come on immediately after exposure to the trauma, but if they occur after 6 months, then we say delayed onset post-traumatic stress disorder. Sometimes post-traumatic disorder changes your life and you begin to even doubt about the existence of reality or promises like religious promises that there's a heaven somewhere, and you begin to wonder how God could allow such trauma to you. For example, imagine what is happening in Palestine right now. How do those people begin to feel that indeed there's a God there looking after them? So you develop what we call complex PTSD. But depending on your age, if you're a child, you can't quite understand these things very well, depending on your age. So we say that you go through developmental trauma, which will manifest differently depending on how old you are. So what is today's post-traumatic stress disorder? Today, we know that in the general population, about 1% have gone through traumatic situations, but it depends really on the community being surveyed. For example, women tend to face more trauma and they will have higher prevalences than men. Young people face a lot more trauma than mature people. And the elderly also face trauma, especially with elder abuse. The closer you are to the traumatic event, for example, in terms of time, if a war has just happened, or to the place, or if you are right in the trauma, like for example, when we went through the COVID pandemic, or when you're in the midst of a war, or when you have domestic violence happening to you all the time, you tend to have higher rates of PTSD. The symptom occurrence is influenced by the severity of the trauma and what this trauma really means. For example, if you are singled out because of attributes you cannot change, For example, somebody traumatizing you because of your tribe or your race or your religion, something you cannot change, or when it is repetitive, or because you're socioculturally vulnerable. That kind of thing which pushes you in a category tends to cause more traumatic symptoms. But we also know that man-made disasters like broken dams or plane collapses or train disasters can also cause trauma, in addition to the natural disasters like fires that you've been seeing all over the whole world because of climatic change, or floods, all of these things that we have been seeing, especially in our environment. Kenya has just gone through very horrible floods, recently, for example. Also Uganda on the western side. So we can see acute or delayed or chronic or complex traumas. But what about war? Wars are rampant these days. They're everywhere. We see them everywhere, especially in Africa. In the past, as you can see by those graphs, in the red showing soldier casualties, wars killed more soldiers. And as you see in the black, on your left, especially. Now, those earlier wars, there were very few deaths. But as times have gone now to the present, we are seeing less soldier deaths and more civilian deaths, to such a point that in some wars, there are hardly any soldiers dying, but civilians are dying. And this is because wars have changed. They've become more traumatizing to the general population. And that's what we want to think about as we think about traumatic situations on the African continent. What kind of mental illnesses happen in war-torn communities? One is that, next slide, please. We see many cases of severe mental illness, psychosis. We see people who are psychologically incapacitated. Next slide, please. I'm sorry, not yet. We see, can you go back to the other slide? Yes. We see serious family conflicts in slides. We see clinical presentations of depression, of PTSD. We see people fearing government for whatever has happened, especially if there have been riots in the country. We kind of tend to seek justice or revenge, sometimes when you cannot see justice coming. Then we have mental and physical exhaustion, and often there's demoralization. And these things have been shown to increase with today's traumatic events. So who are the vulnerables in war, especially? We see that women, next slide, children, the elderly are particularly vulnerable in armed conflicts of today. The women and the elderly are physically weak. They do not carry weapons, as are also the children, and they're not trained to fight. So women are themselves not socialized to aggression and destruction, but rather to reproduction and nurturing. So in most situations, you find that women, children, and the elderly only run and hide, and they tend to get left behind in most situations. So in most cases, as we see in today's wars, we see them being most traumatized. And that has happened in Africa a lot. In most cases, there are no resources that would allow these vulnerable groups to get very far. In most post-conflict communities, women, children make up the bulk of the survivors of war and traumatizations. We've been trying to study and map violence in war traumatized communities in Africa. And I'll just give you an example, for example, sexual violence, which we saw in Liberian women during the Liberian War, that many of them, almost 20%, had at least, that means 1 in 5 had had rape meted out to them. Sometimes gang rape in about 14% of them, or attempted rape in about 17%, or others going to forced marriages, or what we call sexual comforting, meaning that they follow soldiers around or combatants around, tell them not to traumatize them, and provide them with sexual favors. We saw lots of defilement, sex with young kids below 18 years old. And then we saw commercial sex in exchange for food, for security, for money. And then we saw forced incest. and then also abductions with sex. And we've also saw instances of widow inheritance, and traumatizing women's private parts was frequently seen in about 20% of cases. So you see a lot of trauma to women, just as an example. So let's talk about this mass trauma in Africa. We have faced a lot of trauma in Africa for more than 500 years. For example, those many years of slave trade, almost 400 of them, Africans were always raided and taken away to distant lands. When the slavery stopped, colonization came and evangelization. And these were forced on Africans, and they forced many wars on African peoples. Conversion was not peaceful. It was always followed by gun, Bible in the front, gun at the back. Then after that, we fought the colonialists to take them away. Mau Mau rebellions, Maji Majis in Tanzania, and others in many African countries, ANC down south, you know. So we had wars for independence, and this took long times, sometimes 50 to 100 years. Then post-independently, we have continued to fight different ideologies, different religions. Now we're seeing fundamentalisms, as you see in West Africa a lot, especially El Shabaab and all of these things. We fight over our resources, we fight over borders, we threaten each other. There's a lot of trauma in Africa. But there's also trauma in peacetime. For example, domestic violence, family violence, election violence, which we have almost seen in every country in Africa. Child abuse, and including sexual abuse, it is common. In the last few decades on the African continent, we have experienced more trauma and continuous trauma than any other continent. And we will continue to do so, causing large numbers of our people to suffer these armed conflicts. And most of these conflicts are actually internal, in other words, civil disturbances. So the consequences have been physical, psychological, and social traumas, with extensive displacement of civilian populations, among others. The majority of the victims are non-combatants, rather than the fighting forces themselves. And the majority of the war-related traumas, the victims are women, children, and the elderly. And I want you to bear that in mind. In the next slide, we'll just show you examples of wars that have been happening in all of these countries. And usually this was taken a little bit earlier, but almost now, there are twice as many conflicts as happening. You just have to look in your neighborhood. You know, you go in Sudan, you go in Ethiopia, you go in Somalia, you go in Congo, in Nigeria, Mali, Central African Republic. It doesn't end. It is continuous, and anytime another war could break out. So there's a lot of trauma on the African continent. So if we took, next slide, if we took what we call, like you do income per capita, if we took trauma per capita, you see that Africa is sharing almost 90% of the traumatic capita or capital, compared, say, for example, America, where it is about 1%, Asia, about 8%, Middle East, maybe now a little bit, maybe 2%, Europe, about 2%, but Africa is sharing the big majority of the traumatic situations. So it means that we're traumatizing ourselves a lot in Africa. So what is our mental health dilemma as a result of these traumas? One, in Africa, we are resource poor countries. The majority of Africans are poor, and we are overburdened by poverty and diseases, malaria, HIV/AIDS, TB. And even when the pandemics come, they torture us more. So we get mental health challenges that are almost insurmountable, consequent to these infectious pandemics like HIV, Ebola, COVID, and the war traumas that are incessant, and now poverty, mental health illiteracy, and now climatic change has also come in to bring more disasters on the African continent, and we don't have resources to deal with them. We have very limited resources to deal with these problems of mass trauma. And we have a paucity of interventions. Many times we just look on for the trauma to outlive itself. And we don't have preventive policies, and we have poor governance on the continent. So with an ignorant populace and low literacy rates, we suffer a lot consequent to trauma. And most of this causes mental health problems. So what are the consequences of trauma on our African populations? We find that we have lots of migrations, forced mass movements, and population displacements, lots of refugees, almost in every African country. We have internally displaced peoples, and epidemics keep on breaking out. We have hunger, and then we have substance abuse, which is coming in as people deal with these, like alcohol and drugs. Then we have some of our migrants coming back, and sometimes they cause wars. And sometimes if they've been abroad, they come with lifestyle diseases, like more drug abuse and stuff like that. We have human rights concerns, for example, rapes, sexual abuse, and now people don't have access to care or shelter or food. We have capital flight, the best in Africa, study and get away. We waste our resources and we always remain with the illiterate, the underprivileged, and we go through these vicious cycles of underdevelopment. We have health disability. We have lots of breakdowns in our health systems, which become overwhelmed. So we tend to have social and mental health problems, increased delinquency, addictions, post-traumatic stress disorders, and syndromes that are difficult to understand. Like, for example, Nodding syndrome in Uganda, or trauma syndrome in Congo. We have lots of depression, lots of anxiety, lots of family breakdowns. We have epidemics and pandemics we cannot deal with. And then we have these cyclic conflicts, generational traumas that keep on going from one generation with revenge feelings only to cause another war in the future. And we have erratic governance systems, like you see all these dictatorships ending up eventually in wars, as for example, we see in Sudan and other countries. We have lots of urban poverty, overcrowding and crime, and these things go on for generations. So we have this transgenerational transmission of traumatic events. So next slide, just to give you an example, that the number of refugees is always growing up, as you see that vertical line going up in Africa, and we really cannot deal with them. As I speak right now, there are massive refugees, for example, in Sudan, Central African Republic, Western border in Uganda, and it keeps on going in Nigeria with abductions. Next slide. For example, you see this slide, that one, showing refugees in Somalia, really at the Somalia-Kenya border, which had huge, and still has, huge numbers of refugees. And the trauma continues. And this is almost true of many African countries. Orphans. This slide is from Uganda, where you see many orphaned children who were camped in IDP camps in northern Uganda during the insurgencies there. And this happens, for example, this is now happening in Congo as we speak, or in Sudan as we speak right now. Next slide. And then you see these children developing syndromes you can't understand, like Nodding syndrome. Is it a malnutrition? Is it war trauma? Is it a new disease coming in? What is it? And even up to now, no one has found the real cause and solution for Nodding syndrome. Although we know that once the wars stopped, Nodding syndrome disappeared. So it means it was very much tied on to trauma. We see, next slide, we see this urban overcrowding and poverty. These kind of scenarios are all over Africa, in African cities, massive slums, with people running away from traumas on the countryside and coming in cities where they can't afford, they don't have jobs. We see overcrowding and massive diseases. And then we go next slide. Then we go to our hospital systems. We see overburdened healthcare systems. Hospitals are always full, including floor cases, whether it is natural diseases or trauma diseases. For example, this was an HIV treatment center in Uganda. It is overflowing. We cannot deal with this. Next slide. We see very sick people in communities, lots of poverty. Look at the poor housing in the background there. And this lady there who was really suffering, holding her massive numbers of pills. So there's a lot of suffering. Next slide. Then we see this vicious poverty, especially in rural populations, where 80% of the world's poor live. And most of them are in Africa. Most of these poor people are peasant farmers, nomadic herdsmen, fishmongers, of course, women, children, and refugees. and they lack food, they lack water, and many of them are on the verge of starvation. And many die per year of hunger or preventable diseases. And most of these we find in our conflict and post-conflict countries, almost in every other African country that you want to think about. Mental health problems, we saw post-traumatic stress disorder in all its complications, whether simple, complex, or following way. We saw development trauma disorder in children. We see lots of depression in our communities. And then we have this what I call somatization, people coming in with physical complaints for which one cannot find a cause. We call them conversion disorders or dissociations or somatoform disorders, to use psychiatric language. But really, and people waste a lot of money. Eventually, they say they have been bewitched, and they waste a lot of money trying to find solutions, when really what they're suffering from are consequences of trauma. We see a lot of substance abuse, alcoholism, street drugs, marijuana, cocaine, and new ones being brought into our countries. We see lots of epilepsy, we see psychosis, and we see lots of anxiety happening to our people. So as you see in the next slide, most of our people suffer high rates of mental illness, either traumatic depressions or post-traumatic stress disorder or substance disorders like alcoholism or anxiety. Just to mention a few. Whether you have faced a trauma directly or whether your relatives have been affected by it. Our youth are engaging to substance abuse. You can see all of these young people just drinking away. Even a young mother with her child, she's in this drinking place, and with many African countries can hardly deal with this. So how do we manage these mental health problems, of trauma? One, we have to assess the patients. But whenever we have seen situations of trauma, whenever we see them, we have to do some kind of crisis intervention. In other words, we have to do a crisis intervention to remove the individual from the traumatic situation. We shall see a little bit of this later. Then we go to treat their various symptoms. I will not go into details of those, leave them to the experts. Then we manage the complications. For example, from the trauma, do they have wounds? Do they have injuries? Do they have infections? And we can refer them to special cases, for example, addiction centers or surgical centers. But in the long run, we tend to want them to be rehabilitated. But many of our populations seek redress, although they never get it. But my thinking is that we have got to think about how to prevent these traumatic situations. So what is crisis intervention and debriefing? One, we have to rescue the patient or the people affected by trauma from the places of trauma. If a lady is being traumatized by her husband in family violence, they have to be removed. If a child has been abused in incest, they have to be removed. If people are being affected by war, you have to put them away from the war, from the warring factions. For example, as we see now in Eastern Congo. We have to provide security, and we tend to take over the decision making. Traumatized people cannot know how to get out of traumatic situations. It has to be someone else to make the decisions. We give them psychological first aid. Then we care for their immediate needs, food, shelter, security, and attend to their immediate injuries. And then we do debriefing, and hopefully we do follow-up care. We treat the symptoms, next slide, either as emergencies, or the acute symptoms they may have, or the very distressing symptoms. Sometimes we treat the underlying diagnosis, complicating symptoms. Sometimes they have more than one symptom or one disease. For example, one can have alcoholism and depression and HIV. We treat all of that. But we also have to know that they tend to get long-term symptoms, which must be treated. I thought I should tell you about counseling for trauma victims. This is the most popular thing. That after proper assessment of the traumatized, you make a diagnosis, but really we make a problem list and we prioritize it. What does this patient need now? For example, a patient has been raped. What do they need now? One, are they going to become pregnant? We have to give, post-pregnancy, pill to stop them getting pregnant. Have they been infected? Do they have food? They have where to go. we address those first. Then we have to choose the kind of therapy we're going to give. Individual, group, or family therapy. Sometimes the whole family is being traumatized. We aim at reducing the symptoms that is most disturbing to the patient at that time, and not to allow the symptom to go on. We encourage them to be self-reliant and independent. We help them come to terms with what has happened. So you have been raped, but you have to move on. You can't keep on crying and starve your children. Life has to go on. You've been hit on the head, what next? We have to encourage the community to get together and to forgive. Otherwise, we're going through these vicious cycles of trauma. And to get along, to avoid these transgenerational transmissions so that you don't carry vengeances to the next generation. We have to use techniques that suit the individual or the situation, either client-centered therapies, but we have also tried to do therapies that are important to us, like GSP, but I'm not going to carry through those techniques. So in the next slide, I'll just try to show you some of the victims of trauma. For example, you see that woman, on your left, who was traumatized and her face was disfigured. The other one, on your right, is a lady who was burnt by acid from a co-wife. The one in the heart, these were burnt in refugee camps. So we see lots of trauma even in African situations. What about managing complications of trauma? Like depression, panic attacks, phobias, substance abuse, psychosis, seizures, physical complications like wounds, head injuries, fractures, sexually transmitted infections, pregnancies which are unwanted from rape. The most important thing is to refer to those who are specialized in managing them. For example, to treat the HIV, VVFs, vaginal fistulas, or sexually transmitted infection, fractures. Then many times we face domestic issues like family breakups, orphaned children, abandoned children. We refer the special cases who have medical problems. They may have gynecological problems, surgical problems, psychiatric problems like substance dependence, family problems, school problems, severe poverty, teaching them about income generation, and then legal problems. They may have their land, for example, taken away from them and redress. So in the next slide, I just stress what some victims have said. You see that lady in the green long dress, we call it the suit in Uganda here. She's describing her chronic abdominal pains, which came from traumas, rape traumas during the war. And the other one is trying to describe what is happening to her genitalia, the pains that she's feeling from gang rapes she suffered in the past. How do you address things like that? So how do we do, next slide, how do we do rehabilitation and redress? One, we aim to reintegrate the patient back into the community. They have to go on, they have to live on. They can't be hospitalized all the time. To come to terms with what happened to them and accept it and put it in the past, but to avoid self-destructive practices. For example, those engaged in alcoholism or drug abuse to survive the traumas that they had, not to want to think about them. And we'll have to teach them to forgive, but never to forget what happened to them, but to let go of revenge feelings, to move on with their lives, and to seek redress where it is due or possible. For example, reparations, land problems, compensations, or community development. We encourage our governments to rebuild the communities again. But then there are intractable problems. What about those who are put into forced marriages and they have had children? Like you see that girl on your right, who was forced to marry soldiers, rebel soldiers, and had those children. Now she has grown up. She's thinking about it, as you see on the left. She's thinking about it. Meanwhile, the young lady sitting down there is a child that she produced as a result of forced marriage. What do you do? So we have to think about, next slide, please, how we shall prevent trauma. To me, I think that there's a need to teach human rights in schools and communities so that we get generations that are aware of the rights of others and not to carry on traumatic experiences or vengeances to the next generation. We should try to encourage transparent participatory governance. We cannot go on with dictatorships and repressions. These things cause wars, which become vicious cycles. We have to reduce illiteracy. We have to educate all and employ all as much as possible. We should not leave education for the few who are privileged. No, that causes wars in the future, as we see. By the way, many of these soldiers that you see are illiterate, and the vulnerable populations that war perpetrators take advantage of to make them perpetrate more trauma. We have to stop what I call this runaway warring in Africa. We can't keep on fighting all the time. And the African continent is bedeviled by continuous wars, which only serve to keep us underdeveloped. So there's a need for all of us on the African continent to take a conscious effort by all Africans to avoid war and these traumas. And that's very important. So I thought I should, near the end, tell you about how to be happy in a traumatized Africa. And I think the most important thing is to know where you are at any given time in Africa. What's really your background? What about your family? What's your education level? What can you do? Are you a genius or are you average? You have to know your culture because that's where you get your support from. What are your beliefs and worldviews and philosophies? And these are yours. Let others have theirs. Don't force them into yours. For example, I've seen what happened about cults, both in Uganda, here in Kenya, people being put into these very difficult situations with mass deaths. Know your colleagues, your neighbors, and their limitations. Know their strengths and their weaknesses. Don't go to challenge them, but just know them so that you can get along. Know about their personalities and ambitions. Avoid intrigues and prejudices. We have to let go of our prejudices, some of which are historical. Know your culture and its shortcomings, but also its strengths. Know your society, know your country. Where are we at? We are not America. We are not Britain. We are not China. We are in Africa. What about these artificial boundaries? Why should we fight to preserve them? Why don't we get rid of visas so that we can enjoy our continent instead of fighting each other over artificial boundaries done almost 200 years ago in Europe for the benefit of Europeans? We should always read and seek to know and not necessarily take things for granted. We should question things that are being put to us. Why should we have religious wars on the African continent as if we didn't have our own religions in the past? And we're fighting ideologies put on us and perpetuated by usually people from outside. We should try to love and help our fellow citizens and to know our potential and how to help our neighbors. We should avoid detractors. For example, substance abuse, drugs and alcohol, affairs that are meaningless, breaking up families, this insatiable greed for money which drives corruption in our communities. We should learn to care for our families, and then our country, and finally our continent. We should have Ubuntu in our ways of thinking. Finally, we should put fun in our everyday work. We should learn to relax, travel. I liked very much when Grace talked about all of these various places within East Africa that we could visit and enjoy ourselves. It's our continent. We should be able to go to conferences and holidays and party and eat out. We should enjoy our continent, but we should be peaceful. We should be peaceful. We should love peace, and we should wish it for ourselves and for our neighbors. Ladies and gentlemen, I would like to end there. Next slide. Saying we should take a walk and talk. Thank you. That's it.
Wow, wow, wow. Let's give Professor his virtual claps, his virtual celebrations. Pass some love. I see the chats and the virtual claps and the celebrations are coming and coming. This was amazing, really. And I like, let's take a walk and talk. Amazing. That is so, oh my God. I'm still processing. And okay, so I'm gonna stop sharing this slide so that I can see what's on the chat. And I can see the chat has been on fire. And I hope that if you had any questions, I hope you can please copy paste it on the Q&A for ease, but I will try and look for that. But Professor, that is profound. I mean, that was just amazing. I see on the chat it's well articulated. Somebody says a different perspective and holistic lesson on mental health. Great insights. That is very, very true. I think there's okay. All right. Hey. Okay. So I'm seeing most of the most of the
there's a Q&A.
Yeah, I'm seeing there's something on the Q&A who says, can we get the slides? Very informative.
Can get them.
Yeah. There's a question I wanted to ask. You have done such an let me see, why is this one crying? Indeed, I need a walk and a talk. That was just amazing. The whole world needs this. Okay. I wondered why you're crying. Okay. All right. So my question is, what do we do about people who are in denial?
Aha. Very interesting question. Denials happen on all fronts. For example, one can deny after trauma that has not affected them. But to me, I think the biggest denial is in our leaders, denying that there are problems and shutting their eyes and really driving populations into violence. That's a big problem. Denying the obvious, religious leaders pushing people into situations really where you know that it's disastrous. You know, how do you get people and tell them to starve to go to heaven? And how do you preach to poor people and tell them to give up all their possessions? In Uganda recently, somebody was trying to walk them to Ethiopia. And the educated people who lead these people, you know? So to me, these are where the problems are. Why don't our governments look into wanting to actually regulate the massive proliferation of churches that mislead our people? Not saying that there should be no religious freedom, there should be religious freedom, but why shouldn't we know and be able to say, no, look, there's something not right here, you know? You can't tell people to get rid of all of their possessions and promise them heavens and stuff like that, when you know that one is just exploiting them to take their resources. And you see it happening day in, day out. You know, TB Joshua in Nigeria, how could he have done that for so many years and left in the guise of religious freedom when you know that he's actually traumatizing people? These kinds of things. To me, I say we should be able to question things. We should be able to have discussions about them. And we should practice Ubuntu. That's the principle in Africa. So I don't know if I have answered that.
No, you have answered it partly, because I totally agree with you. I mean, in Kenya, I think sometime a while ago, we had people who were buried alive.
Yeah.
So I mean, and it goes with Brenda's question: how can faith-based communities help in creating awareness?
A very interesting question. I have been asking myself that a lot. Not just faith-based communities, but how do we increase awareness and illiteracy? By illiteracy, I don't mean, you know, reading and writing, but ignorance. To me, I think that there is a split between the educated, the elites, and the common people. The educated in Africa are caught in a vicious cycle of wealth accumulation. Something really antithetical to the Ubuntu philosophy, whereby we shared resources. But now it is without guilt, we are accumulating them. One to the point of getting planes when the neighbor is starving. You know, like I'm not condemning anybody, but I'm just saying we should have a way of looking at these things in an African context. Not that we should, but this unfettered capitalism, for example, and I'm not saying that, you know, I'm trying to advocate for communism or socialism or anything like that, but we should look things from an authentic African way. How were we able to manage these things in the past? How do we bring this African collectiveness or collective wisdom over the years into our governing systems today, so that we can have and enjoy Africa as a continent for all? How come we are selling off our resources blindly? And the only thing we do is to buy guns. We don't manufacture these weapons, we buy them. That's what we are doing.
Yeah.
Or resources. The more the country has resources, the more the wars. You just have to look at them. You see a country that is rich in oil, that is rich in minerals, even the recent AI minerals. Already we are fighting, you know, to traumatize our populace. Why can't we have governance that says, no, this cannot be? So to me, I think that the African elite have to give up some of their greed and begin to look at collective responsibility. When everyone is okay, you enjoy a good life. My dad used to tell me, if you don't help your family, if you don't help your relatives, if you don't help your country, you can't enjoy it. You can't ride a Mercedes-Benz on a rough road unpaved. When you allow corruption that takes away money that could do those roads, you'll not enjoy your car. So to me, I think that as elites, we have to think about that. We also have to think about using African resources to educate ourselves and then leave. You know, in others, we are robbing Africa of its best. That's why I'm questioning these migrations and our governments actually helping. And it's all over Africa, especially in East Africa here, helping our people go to the Middle East to work. Why? We have a lot of work here that we could do for our people. Why don't we make it easier through government efforts to employ our people in a way, instead of sending our best, our youth, to work as slaves in other countries? These are things we should have live debates about.
I agreed with you, Prof. Agreed with you. There's an interesting question that has been shared. So there's a question here who says, I went into denial after losing my parents. I never grieved, and today I'm just a crying baby. Every small pain inflicted on me, I cry. When I see people crying, even strangers, I cry. Other people's pain brings tears to me. How can this be explained?
That individual is traumatized. They never walked through their grief. To put it very briefly, when we are hurrying with socioeconomic advancement or work, we don't have time to go through our cultural sanctioned grieving process. Let me give you an example. When I was young, somebody would die in the village and nobody would go to work. We all went to the bereaved family to help out, to grieve with them. And people would stay a week or two. And then later, they would keep on coming back to go grievance. You know what's happening right now? People die. You don't bury them all in the city. And all the urban dwellers collect themselves and they go for 1 hour or two to bury, eat all the food that they have found there in the countryside, leave the people starving there, and then come back in the city. And I'm saying, is that African? Huh? Really that you just go and leave? That individual is traumatized by urbanization and a new way of life, which is not cognizant with what Ubuntu taught us. So to me, I think she or he should begin to think about that and maybe carry out a cultural ceremony to grieve properly.
Yeah. Somebody saying some of us are just hardened by miracles, but it's not easy. Yeah, I mean, I keep saying on these sessions, and every time we hold a mental health session discussion, keep saying, please normalize going to therapy, normalize seeking help, normalize dealing with your trauma. It's the only way you can actually live life to the full and walk the talk, as Prof has said. But Prof, there's another question. There are a few questions. No, before I answer, I ask you probably two of the other questions. Ladina Msigwayu says, I think another thing that is not talked about in Africa is postpartum. We actually did a session on postpartum depression. You can check our YouTube channel. The YouTube channel is named Get It Right with Atara Solutions. If you scroll down the videos, you'll see a link that we did on postpartum depression, just to support in creating awareness and also support group for those who suffer postpartum depression. There's a question here that says, on the section of rehabilitation and redressing, making someone to not forget the past, will there be negativities in their developmental status?
Children that have been traumatized and are given a message of revenge will carry that. But if they're just given a message of saying things went wrong, they cannot be allowed to get wrong again. We'll have a positive message of saying wrongs were done, let's correct them. Let's give you a vivid example. Israel and Palestine have been at each other for more than 2,000 years. They use the same methodologies. Whoever is stronger tries to wipe out the other. As we speak right now, Israel is stronger. Many years back, Palestinians were strong, or whatever the group was, Philistines, whatever it is. This viciousness, this cyclic traumatization, which goes through generations. We have seen it in Rwanda, we have seen it now in Palestine, we saw it in Europe, we're seeing it in Ukraine. These are things we must stop happening here. Not that in the ancient times, African societies never used to fight each other. We used to fight each other, but we had cultural ways of appeasing. Let me give you an example. I come from central Uganda, here they call it Buganda, and we used to have wars with our neighbors, Europe, the West, and stuff like that. But at the end of the war, there would be wife swapping, if you want to call it. Either whichever side would take the women. The other side, if it wins a few years later, and eventually people became actually nearly the same people. In other words, they become your uncles, your aunts, and what? There was no genocide. But
Yeah,
creating genocides, that's not what we want. So there is something we're not doing right. We also put up laws that are very traumatic to people, very exclusionary. We don't tolerate differences or deviances, and that causes a problem. Africa was not like that, and it should not be like that.
that's true. I see Joseph Ajal. Hi, Joseph. He says, I have the most respect for Professor Segane Musisi. You're doing a great job. Keep it going, Prof. Yeah, and then probably the last question, I think, is okay. Abigail says, how can we ensure research ethics while using people's images?
Okay. Many of those, in fact, I was going to say, many of those pictures you saw were pictures that we got during our research times on people who actually agreed to show them, except the children. But the children, there's a way you get consent for children. Those were times when we were doing interventions. I'm glad to say that most of those are now grown-up children. Camps were closed long time ago. We actually worked. I had even an NGO helping these people. So it was very ethical. It's not abuse. It is just showing you what Africa is doing to each other. Another question, who makes those research ethics? Are they really done with African authenticity? Do we hide the suffering in Africa? But when you go to hide in these guidelines formed in other countries, in other cultures, you get a problem. You know, how shall we deal with rape trauma, massive rape trauma? One in, they say, for example, in the Congo, 80% of the women there get raped. How do we deal with that? By shutting it out. These are the questions to me I ask our Africans, and I say, look, we have to define our problems, we have to deal with them. Did they not show concentration camps in the Second World War with the Jews? You remember Auschwitz and stuff like that? Did they get permissions to show them? But up to now, we still show them. And we say, never again should this happen. If we don't do that on the African continent, we shall be in that denial. I have not shown you more pictures of refugees walking across continents, across countries, you know. We have tracked them, we have seen them. I haven't shown you some other pictures, for example, election violence in Kenya, not this one, but a long time ago when people were being burnt alive, you know. I haven't shown you the mass graves of cults, you know, with dead bodies being gotten out of infernos or dead pits and mass graves. So, yes, if we don't face African reality in our authentically African ways, with ethics generated from our ways, it will not work. Believe me, those researches were done in the most ethical way and published in the most ethical journals, and I don't have them in my possession. I'm actually getting them from published articles on the internet.
Right.
They're there.
Prof, there's an interesting question here from Teresia. It says, my father has been diagnosed with depression. We have done our best to help him, but it keeps worsening. At times, he is violent. Other times, he is silent but walking around the house. So I think this one is stuck on, actually, there's no question there, but I think they're stuck on what else they can do.
I think he should need proper psychiatric assessment. For me, it sounds to me like there are episodes of violence and maybe overactivity, and then other episodes of quietness and withdrawal. And that is typically what a condition they call bipolar disorder.
I thought so.
And it's treatable.
Yes, and bipolar disorder,
mental health literacy. It's not witchcraft, it's not demons, it's not genies. But
Teresia Boniface, you can check out our YouTube channel. We did a session on bipolar. However, you really need to get your dad proper psychiatric assessment. Probably the depression that they're talking about is not the depression that it's probably
you can just talk out of.
That this one probably needs medication. So therapy may not work on its own in that case.
There's a YouTube I did on bipolar disorder. You put in Musisi bipolar disorder YouTube, you'll get it. But in addition to those other ones.
Definitely. So yeah, I think more information on that. So somebody says, what happens to a client? Where is that question? Judy says, Prof, is there such a thing as someone going through trauma exposure but actually do not get PTSD? And is there a solution for someone who has countless trauma experiences, like one after another after another?
Let me begin with the last one. Repeated traumatizations cause complex PTSD. It was one of the classifications I showed. And people like that tend to live with lifelong trauma feelings and they need long-term help. The first question was?
The first question was on, is there something like going through traumatic experience and not getting PTSD?
Yes. Not everyone going through traumatic experience gets PTSD. We did not speak about risk factors for PTSD. I did not have time to go through all of those things. But certainly not all. The only thing I showed there was that depending on the repetitiveness, on the timing, and the meaning of the trauma, if I torture you because you belong to another tribe, that has hurtful meaning. If I just slap you or cane you in school because you have failed the exam and I want you to pass, you may just know that I was caned. You may not get a traumatic experience all life.
That's true.
So the meaning of the traumatic event, for example, what we saw in 1994 in Rwanda caused a lot of hurt feelings because the meaning was to wipe out a community, a group, a genocide. That tends to perpetuate traumas. And that is the question now being asked in the Middle East, in Israel. Do you think that wiping out one group will stop the next generation from causing the same problem? Why has it been recurring for 2,000 years? We have to rethink of these things. But I will not go to other nations. I want to stick to the African continent. How do we deal with these repetitive traumas that we're having in ourselves?
Yeah. And Janet says, or rather, there's somebody else who has sent me an inbox. I went through domestic abuse and shut it out. I can't have a normal relationship with people. I think I am toxic. Do I have a mental disorder?
I think she has PTSD.
I think so.
And I think she should go and get therapy for it.
Yes. My friend, you need to seek healing for your post-traumatic disorder. I don't know which country you have logged in from. If you're in Kampala, you can seek out Professor Musisi. And if you're in Kenya, you can get in touch with us and we can be able to also support you on that end. Probably finally, you can answer on the corruption. How can we come together in fighting corruption? Is a question by Rose.
Thank you very much. That's a very good question. You remember what I talked about transparent governance and the participatory governance? If we allow that to foster in Africa, we'll overcome these problems. But if we go to suppress communities, whoever talks about it becomes an enemy. We shall pay lip service and we shall live in denial.
That's true. This is interesting. Somebody says, in the essence of an introverted or loner personalities, they tend to keep matters within. Some do feel insecure around such people. So what's the best possible solution to show them love, brethren? Others confuse being a loner and being traumatized.
Well, that's a long question, but
I know.
there's something we call personality disorders or personality styles. And there are about 11 of them, and I will not go through them. But one of them fits that description. And one can get treatment for personality disorder through long-term therapy.
That's very true. You can recover from the personality disorders. Wow. I do not think we can conclude this conversation, Professor Musisi. So we are going to allow you to go and enjoy your cup of tea for the evening.
Dessert?
And your food. You know, Ajal and Herbert are very keen to make sure that I remember. The food that we talk about in Kenya is not the same in Kampala. If I say food, I will be served matoke. So I'm going to allow you to go and enjoy your matoke.
Oh, ugali. We have ugali. We call it posho.
Yes, yes, or posho. And the chicken in banana leaves.
All these African foods, and I enjoy them all. When I go to an African country, I make sure that I eat the local food somewhere.
I know, right? Absolutely, absolutely.
So when I come to Nairobi, you know what to feed me.
Yes, nyama choma and ugali.
Yes. But I saw Katogo in the Hilton, and I was impressed. The business of not having African foods in good fancy hotels is wrong. So that's why I liked Hilton, because I saw Katogo there.
Oh, they used to have Katogo.
Yes.
All
I
right.
also seen Narushi, and they called it Katogo. Interesting.
Okay.
Yes.
Interesting. So we really appreciate you giving your time. Really, really appreciate. Thank you so much for being part of the change that we want to see. Thank you for challenging us in our mindsets. And thank you for just making us want to do better. And probably I could ask, please give us your parting shots.
I think I did. There is something I said there. There's a need for a conscious effort by all Africans to avoid war and traumas.
Yes.
Yes. Be peaceful,
Excellent.
love peace for all.
Thank you. And we talk the walk. We walk the talk.
Yes, let's go and talk. Not let's go and fight.
Yes, let's go and talk.
Walk to talk. Yes.
Absolutely, absolutely. So thank you so much for inspiring us, for just giving us more information. I think I am more educated. Today is an angle of mental health that I've never thought about. So thank you. I knew part of our problems were historical, but it's really come out very to the fore. And I hope that we continue doing better and just choosing better making better choices. So to our partners, we really thank you. Thank you for the support. Herbert Zake, Steve Karangwa from Rwanda, and Zake from Uganda. Thank you so much for the support and sharing out our flyers into those countries. And also our audience, I see Maston Miner, I see Richard Magoma. Thank you very much for keeping it, Get It Right with the Tara Solutions. And we are really, really honored that you, our audience, could join us. If it is your first time to join us, please make it a point to be here every Tuesday at 8 p.m. We do this every Tuesday. We have different topics. Like next week, we are dealing with audit. And the week after that, I think we'll be doing a HR topic on AI. And a week after that, we're going to be looking at entrepreneurship. So we have a lot in store for you. So please join our WhatsApp group. I don't know whether Jacinta is still around. Jacinta, are you there to share the WhatsApp group link? You can share the link on the chat. And then if you have joined us for the first time and you can look forward to the recordings, please see them on our YouTube channel, Get It Right with the Tara Solutions, and you will be able to catch up on what is happening there on matters learning, because we do this every Tuesday. I say we are on a mission to change the world through information. Please be part of the change that you'd like to see. So I'm just gonna copy post this WhatsApp group. Okay, yeah, so Jacinta has shared that. And for those who are in Kenya and those who are in other parts of the country and you'll be around on 22nd of June, please join us for the men's conference, and let's also support the male child, the boy child who I keep being told has been left behind. Let's help them in developing their leadership capacity as well. So allow us to call it a night, and thank you very much for your participation. How can I reach you? You can send me an email on grace@atarasolutions.co.ke. Let me just type that for you. Yeah. So thank you very much, everyone. And at this point in time, allow us to call it a night. Have yourselves a lovely, lovely evening, and see you next Tuesday, same time, same place, as we look at another totally different topic. And if you have missed any of our sessions, please go to our YouTube channel and get to learn more on what's happening. And of course, Professor Musisi has said he's done a couple of YouTube links. Please make sure you also check them out. If you're in Uganda, please do not suffer in silence. Visit the hospital and just seek help. Professor Musisi and his team will be happy to support you and be able to walk the journey with you. So without further ado, allow me to say good night. I have been your host, Grace Nzula. See you next Tuesday. And Professor, may God bless you abundantly.
Thank you, and bye, everyone.
Thank you.
So I sneak out to the garden to see you. We keep quiet, 'cause we're dead if they knew. So close your eyes. Escape this town for a little